Alrighty, so for this section under the reproductive and GU drugs, I'm going to be talking about BPH and the medications to treat it. So a little bit more about BPH. BPH, or benign prostatic hyperplasia, is going to be the enlargement and inflammation of the prostate gland, which ends up constricting the urethra, and as a result, it interferes with the urine flow from the bladder. So untreated, it can cause a lot of complications. This drug can also be taken to treat hair loss in men. So the way that the BPH drugs works, the most popular being finasteride, is that it inhibits the 5-alpha reductase enzyme, which is an enzyme that helps convert testosterone into dihydrotestosterone. Um, some of the safety concerns with this medication is that it is teratogenic, so women of childbearing age should not touch this medication. And then it can also affect fertility in men, so obviously there needs to be a conversation about that before administering the medication. That would be between the provider and the patient. Other things to check or assess before giving the medication would be checking allergies, the medications that the patient is taking, and if there's any history of liver disease or prostate cancer. Some of the side effects of this medication include decreased libido, decreased ejaculate volume, gynecomastia, and decreased PSA, which is prostate specific antigen, which is usually high in men with BPH. Lastly, there's no dietary concerns with this medication, but we do recommend that patients avoid drinking too much fluid in the evening closer to bedtime just to avoid having to get up to the bathroom so many times. And lastly, just following up with their primary care or the urologist to make sure that the medication is being effective and then there hasn't been any changes. Alrighty, that's it for BPH.
Okay guys, next up we have oxybutynin. It's an anticholinergic. It's going to block muscarinic receptors, allowing the bladder to relax and in order to not have undeliberate expulsion of urine. And why would somebody have this? It's used to treat incontinence caused by an overstimulated bladder. So the diet, you're going to want to educate them to increase fiber and fluids because it can increase the chances of UTI as well as constipation. You want to make sure your patient is voiding every 3 to 4 hours just to help with that chance of UTI. And then for administration purposes, you want to make sure that this drug can be given with meals or milk if you're having GI issues. Assessment, before you give this, you want to make sure that they don't have increased intraocular pressure or glaucoma because they cannot take this medication. Post, you want to look for angioedema, anything that might be affecting the respiratory system, and possible overdistension of the bladder. ADRs, we're looking mainly at exhaustion, constipation, dizziness, drowsiness, and blurred vision that can cause increased risk of falls, so possibly just looking out for the safety of our patients for those. And labs, there's no labs that we have to monitor for the administration of this drug. Hey y'all, so one of our drugs that we're doing today is oral contraceptives. We have combination therapy and just progesterone therapy, so these are the drugs listed up here. Oral contraceptives work by providing estrogen and progesterone, and those work to limit the LH hormone and FSH hormone, which help to induce ovulation. So when we're limiting ovulation, it's going to help prevent pregnancy. And it works by providing a consistent level of hormones for the body. Why would somebody take this? To prevent pregnancy, prevent hormone-induced headaches, helping the period be more consistent by providing a consistent amount of hormones, and it reduces the risk of uterine and ovarian cancers, PID, benign breast cancer, and ovarian cysts. Labs that we're going to want to look at for this drug are watching for hyperkalemia because progesterone is a potassium-sparing drug, so you're going to want to watch potassium in the diet. Assessments, you're going to want to make sure that they have no history of stroke or cerebrovascular disease or any increased chance of clotting disease because our oral contraceptives are going to increase the chance of having a thromboembolism. Okay, and you're going to want to monitor for pulmonary embolism, DVT, or hypertension. When your patients are taking this drug, you want to make sure they're taking it at the same time every day, and if you miss a pill, you can take it along with the next day's pill, but you can only do this for 2 days. If you do more than 3 days, then you have to stop that pack, have a breakthrough bleed, and then start a whole new pack. safety, we're going to watch for hypertension, that increased risk of thromboembolism, and you're going to want to make sure that they're having their yearly screens of their pap smear and their mammogram due to that increased chance of cancer that can happen. And we also want to be mindful of potassium in the diet. Again, make sure that you encourage your patients to stop smoking. They're not supposed to be on this drug if they do smoke, and they cannot take this drug if they're over 35 years old.
Menopause marks the natural decline in estrogen and progesterone production by the ovaries, leading to various symptoms and health risks. Estrogen hormone replacement therapy addresses these changes by replenishing estrogen levels. Estrogen therapy alleviates symptoms such as hot flashes, vaginal dryness, maintains bone density, and supports cardiovascular health. It works by stabilizing temperature regulation, restoring vaginal and urinary tract health, slowing bone resorption, and exerting favorable effects on lipid metabolism and inflammation. However, the decision to use estrogen therapy should be personalized, considering individual risks and benefits, and regular monitoring is crucial to ensure safety and effectiveness. Now, why would a patient take this class of meds? Estrogen therapy is primarily prescribed to alleviate the symptoms of menopause, including hot flashes, vaginal dryness, mood changes, and sleep disturbances. It can also help prevent or manage osteoporosis, maintain vaginal and urinary tract health, and improve overall quality of life for menopausal women. Before starting estrogen therapy, healthcare providers may perform baseline tests including hormone levels, lipid profile, liver function tests, and a mammogram. Depending on individual health factors, additional tests or medications may be necessary. For example, women with a history of osteoporosis may require calcium and vitamin D supplements. Estrogen therapy has a therapeutic window, meaning there is an optimal dosage range to achieve desired effects while minimizing risks. Exceeding this range can lead to adverse effects such as an increased risk for cardiovascular events, stroke, and breast cancer. Dosage should be carefully tailored to individual needs and adjusted as necessary based on response and risk factors. Prior to starting estrogen therapy, a thorough medical history, physical examination, and assessment of risk factors should be conducted. Baseline assessments may include blood pressure, lipid levels, mammograms, and pelvic exams. After starting therapy, regular follow-up visits are essential to monitor response, assess for adverse effects, and adjust treatment as needed. Estrogen therapy can be administered orally, transdermally, via patches, gels, or sprays, or vaginally, via cream, tablet, or ring. The route of administration depends on the specific medication and individual preferences. Patients should be instructed on proper administration techniques and advised to adhere to a prescribed dosage regimen. Estrogen therapy is associated with potential risks, including an increased risk of blood clots, stroke, cardiovascular events, and breast cancer. Other side effects may include breast tenderness, nausea, bloating, and headache. The decision to use estrogen therapy should be individualized based on a careful assessment of risks and benefits. Women on estrogen therapy should maintain a healthy diet rich in calcium and vitamin D to support bone health. They should also be advised to limit alcohol consumption and avoid smoking, as these can exacerbate some of the risks associated with estrogen therapy, such as cardiovascular disease. Patients should also be educated about the benefits and risks of estrogen therapy, including the importance of adherence to the prescribed regimen and the need for regular follow-up appointments for monitoring. They should also be encouraged to discuss any concerns or questions with their healthcare provider. Alzheimer's disease is characterized by the progressive degeneration of cholinergic neurons in the brain, particularly in areas responsible for memory and cognition. This results in reduced levels of acetylcholine, leading to cognitive decline and memory impairment. Cholinesterase inhibitors, such as donepezil, work by inhibiting the enzyme acetylcholinesterase. By inhibiting this enzyme, they prevent the breakdown of acetylcholine, thereby increasing its concentration at the synaptic cleft. This augmentation of acetylcholine helps to compensate for the reduced cholinergic activity in Alzheimer's disease, temporarily improving cognitive function and symptoms. Overall, patients may take cholinergic drugs to address conditions related to dysfunction within the cholinergic system, such as neurological disorders, muscle weakness, urinary retention, and glaucoma. For example, cholinesterase inhibitors, such as donepezil, are commonly prescribed to patients with Alzheimer's disease. These drugs can help improve cognitive function, memory, and behavior by increasing the levels of acetylcholine in the brain, which is depleted in Alzheimer's disease. These medications aim to restore or enhance cholinergic neurotransmission, thereby alleviating symptoms and improving patient outcomes. When prescribing cholinergic drugs, consider monitoring liver function tests due to rare hepatotoxicity potential, renal function tests in patients with renal impairment, and complete blood counts if hematological adverse effects are suspected. Cholinergic drugs do not have a specific therapeutic window, but individual patient responses guides dosing. Excessive cholinergic stimulation can lead to toxicity characterized by symptoms such as excessive salivation, bradycardia, and muscle weakness. Close monitoring for signs of both therapeutic response and adverse effects are essential for safe use. Before administering cholinergic drugs, assess vital signs, neurological status, medication, and allergy history and contraindications. Post-administration, monitor vital signs, neurological status, gastrointestinal and urinary function, respiratory function, and watch for adverse reactions. Provide patient education on medication administration and potential side effects. For safe administration practices, begin with low doses and titrate gradually. Educate patients on proper administration and potential side effects. Monitor patients closely for therapeutic response and adverse effects. Avoid rapid intravenous administration. Avoid use in patients with contraindications, and be mindful of potential drug interactions. Cholinergic drugs can cause various side effects and adverse reactions, including gastrointestinal disturbances, cardiovascular effects like bradycardia and hypotension, neurological symptoms such as muscle weakness, ocular effects like miosis, and urinary and respiratory effects. Excessive cholinergic stimulation can lead to cholinergic crisis, characterized by severe symptoms. Careful monitoring, dose adjustments, and patient education are essential for safe administration and management of side effects. Dietary considerations for patients taking cholinergic drugs include timing medications with meals, avoiding grapefruit juice due to potential interactions, maintaining adequate fluid intake, limiting alcohol consumption, and making dietary modifications to manage gastrointestinal symptoms. Additionally, some other patient teaching includes caution about driving and operating heavy machinery due to potential dizziness or drowsiness, sun protection measures to prevent sunburn or rash from increased sun sensitivity, proper storage and disposal of medications to prevent accidents and environmental harm, and discussion of risks and benefits regarding pregnancy and breastfeeding.
Erectile dysfunction involves the inability to achieve or maintain an erection for satisfactory sexual activity stemming from various physical or psychological factors. Patients take these medications to improve ED, enhance sexual performance, and address underlying medical conditions or psychological factors contributing to ED. By enhancing blood flow and supporting the natural erectile response, PDE5 inhibitors help restore confidence, self-esteem, and overall sexual satisfaction in affected individuals. When prescribing PDE5 inhibitors like Viagra for erectile dysfunction, healthcare providers should assess medical history, screen for concurrent medications, particularly nitrate drugs, evaluate the cardio risk, adhere to dosing guidelines, and discuss lifestyle factors like alcohol and smoking. PDE5 inhibitors have a therapeutic window with recommended doses aimed at balancing effectiveness and minimizing adverse effects. Exceeding this recommended dosage can increase the risk of effects such as headache, flushing, dyspepsia, and visual disturbances. Before administering PDE5 inhibitors for erectile dysfunction, conduct a comprehensive assessment including medical history, medication review, cardio assessment, physical exam, and baseline lab tests. After administration, monitor effectiveness, adverse effects, blood pressure, patient satisfaction, and medication adherence. Regular follow-up appointments may be necessary to optimize treatment outcomes and address any concerns. Common side effects include headache, flushing, dyspepsia, nasal congestion, and visual disturbances. Patient with cardio disease may experience a transient decrease in blood pressure, and a rare but serious adverse effects include priapism, vision changes, and hearing loss. Any dietary concerns or considerations we would look at grapefruit and grapefruit juice. Avoid taking these while on PDE5 inhibitors as they can interfere with medication metabolism. Alcohol, high-fat meals, and nitrate-rich foods. Safety precautions: remind the patient to avoid driving or operating heavy machinery if they experience any dizziness or lightheadedness as a side effects of PDE5 inhibitors.